Well, I wanted to build on this concept of innovative educational pathways. This health equity transformation in the Rio Grande Valley, it's imperative that we have a robust pipeline of health professionals. And I'm looking at the stats right now, and they're pretty daunting. You know, the Rio Grande Valley will have this at the state level, the highest percentage of unmet nurses at 27%. That's 6,274 full-time nursing positions. It's amazing. There's also a critical shortage of primary care physicians. It's been stated that 722 primary care FTEs is the current unmet demand. And then we think about how are we going to address these health disparities in these rural, underserved communities. We have to have the workforce that's optimally predisposed to do a lot of that work in terms of the population health-based interventions, addressing social determinants of health. And we have to think about the role of higher education in terms of providing that level of collaborative partnership with healthcare providers and to really address the acute educational needs and reskilling and upskilling, but also this critical shortage. So I'll start with you, Kim, but I wanted to just ask you, how can higher education better, create opportunities to ensure a safe, effective, and humane care for patients by, building these culturally competent pipelines of nurses and other health professionals to accelerate this transition to health equity in the Valley?
I think it's really going to take, and I think we spoke a little bit about it, collaboration, but within that innovation are different pathways to obtain whatever it is or whatever goal you may have. 91,000 qualified individuals were turned away from nursing programs because they say there were not seats, there was not availability, but yet we know that we're increasing to have this nursing shortage. And again, this is across all of our healthcare programs, degrees, everything that we have. There is a shortage. Our allied health partners that are working with us in healthcare, we have a shortage everywhere. However, we keep seeming to turn students away. So we really have to look at a different way of doing this. How can we create this culturally competent individual, knowing that there is not an unlimited number of spaces, however, also knowing that we need our healthcare partners really to join in this with us. One of the main reasons we can't bring more students typically into a lot of programs is because there are not clinical placements for those students at those programs. So even though the educational facility themselves could take in an ample number of nursing students, the problem becomes you cannot get them through those required clinical placements so that they can move forward. So it's really going to take these innovative partnerships, these dedicated education units, these collaborations within that organization, this guaranteed pipeline of moving the students forward within that. I also think having opportunities where, like I said, many students can't afford to not work while they go to school. So we do need programs for everyone. We need programs where you can work full time. We need programs where you maybe want to be able to go and someone can help support you so that you are able to just focus on those areas. You can take part-time. You can move slowly through that, but also basing it at the pace of the student. For us at WGU, being a competency-based program, it works very much like healthcare. In healthcare, everybody's going to come in and they're going to demonstrate their annual competencies. You are going to make sure they're competent to come in and take care of you. That is a focus for us, so that our students are able to accelerate through our program once they are competent and they've met those competencies. So again, we're not judging them on seat time, we're judging them on competency, which we would want out there. So as we're moving forward, we can spend that time making sure that they are culturally competent, that we have those shared, those the social determinants of health for that individual. They're built into the program. We're looking at it from the very beginning. We're basing it on CUSE and those, patient-centered care is really what we're focusing on. And I think with that, it becomes very important because we're always going to have a shortage, and you need nurses to have nurse practitioners. And you're going to need nurse practitioners to help fill that void that we're going to get from our family nurse, from our family practice partners, because we're really going to need to fill that. They're the ones going out and doing those home health visits. They're the one doing a lot of those areas. So we really have to start building that up. We also need to ensure that our students are coming from the communities in which they serve. I think one of the biggest issues we have is that nursing schools pop up somewhere, or for a nurse practitioner, for allied health, but they're not here. They're not in your community. They're not doing clinicals here. They don't know the individuals here at home. Once you start pulling students away to do something in another community, they very rarely come back. So I believe all of those things are something we have to look at. The education has to be here, the opportunity has to be here, the clinical partnerships have to be here, and the innovative way of being able to teach someone where they are to get them where they want to be have to be here.
Does anyone else want to address this important topic?
Yeah, I adopt all of those comments, by the way, because that's our experience. I served as CEO for Valley Baptist Health System for 11 years, and I'm sitting here reflecting on the challenges associated with staffing, and it's so appropriate to mention allied health, by the way, because the reality is without all components of allied health, you can't run a hospital. There's just no way. So as we're talking about nurses and doctors, those are the highest profile positions, but by all means, those aren't the only areas of challenge for us, right? So programs such as the ones developed at RGV are extremely helpful, so I commend y'all for doing that, and likewise. I'll tell you, I think it's a multifaceted strategy, right? Texas A&M is waiting for final approval from the coordinating board here in Texas to start a program here on our campus in McAllen, right? If in fact, or when we get that approval, I'm anticipating that here shortly, our first cohort starts in January of 26. So even after we get rolling, we're probably going to have about 150 nurse students on our campus. The reality is we sit here today, the programs that exist in the Rio Grande Valley today will not make a dent, right? So you're right about the clinical space. Fortunately, we've received support from every health system in the Rio Grande Valley for our program, indicating we have plenty of opportunity on the clinical space side. But I'll tell you this, that's one component of the strategy. The other is recruitment. How can we best recruit when everybody around the country is recruiting potential nurses as well? We've had some success historically. We had a visa program that allowed us to recruit from the Philippines. We still have a lot of nurses from the Philippines that provide services here throughout the Rio Grande Valley. Phenomenal. Culturally, it's like a plug and play down here, right? Because you're right. The nurses that come out of our programs here, they'll understand the culture. They'll have trained in our facilities. So it truly is a plug and play scenario as well. Same with the nurses from the Philippines. I would urge all of us who have relationships with our congressional friends to urge them to look at reopening some of those visa programs. We've talked a little bit about, Rashmi, about nurses from Mexico, for instance, right? NAFTA has a special designation for nurses from Mexico. Of course, when you're talking about recruiting in, you don't want to ever lose sight of quality, because quality is of paramount importance to the hospital providers, clinical providers, the physicians, everybody, school districts, et cetera. And so it's a multifaceted approach. I think we've got to grow them as best we can with new programs. I commend for Texas A&M for making that effort. I commend the existing programs, but that's just not going to be enough, right? We have to do a good job of recruiting, and then I think we can be very strategic and selective where we're going to try to recruit from, because it's so very important to bring in folks who appreciate our culture, who hopefully know our culture. If they're bilingual, it makes a big difference in our environment, right? All of those kind of good things. But I don't think there's one answer to the question, or one answer to the solution to solve our problem right now.
And I'm here to learn from you, but I can tell you what I do know and the experience that I do have. Hidalgo County received some federal funds, as you know, because of this COVID fight. And we invested $3 million to try to train nurses. And we haven't been able to spend it all yet. And the reason we haven't spent it all yet is because the institution that we awarded the money to can't find sufficient instructors, because I believe it takes one instructor for every 20 nurses. So we have a choice to import people down here or create them ourselves. And in a very competitive world, and being always short of money, because there's always more need than money, then I think we better figure this out, that we're going to have to do it ourselves. We're going to have to train our own people. And when you have limited resources and limited individuals to work with, you want to be efficient. You want to be efficient and effective in providing those services. So I want to tell you that we need to eliminate redundancy, consolidate, and make it right. Whenever we figure it, we have to be efficient, and we can't be efficient by having redundant services. So I beg everyone here, let's get together and work together and solve this problem, because I think we're going to have to look at ourselves as opposed to look to be importing our talent from somewhere else. because I can tell you for a fact, being a numbers person, that we have negative migration. We are sometimes pretty good in creating human capital, but we lose it because the jobs are not here. So if we're not good at giving opportunity to our people, we're going to lose our best people. That's why we've got to continue to work together. And thinking about it isn't good enough. Wanting to do it isn't good enough. Only action gives you results. And it's the type of action we take that's going to dictate our future.
So I want to echo and thank y'all for mentioning all those points, because I hear all the time from our nursing school, one is two issues. Professors is one, because of course people get paid a lot more out in private practice, and nurses were in such high demand that they were being given all kinds of packages to go work. But the bigger issue is not having the clinical spots for them to do their rotations. And we've been trying to get creative in using high fidelity mannequins and other things, clinics, community care clinics to place some of these nurses. But that is where we can use your help, hospitals and others, is to have those spots open for the nurses. Same applies with doctors, with physicians. We get so many residencies requests, and I think I had a number here. Well, I'll tell you this, our medical school, for instance, we get about 7,000 applications for 55 slots, if you can imagine. That's how competitive it is. And so there is a desire to come to South Texas by people, and many that want to stay here. I think this latest class of our medical students is 40% are from the Rio Grande Valley. We're over 30% of all our medical students from the Rio Grande Valley. We've graduated over 200 physicians. About 55% of our residents stay in the Rio Grande Valley to work. That is so critical to us to make sure that people stay here. We want to grow our own. That was the intent of the medical school, and we're aiming to get at least 50% of our class being from the Rio Grande Valley. In fact, we recently started a scholarship program that's merit-based called the Luminary Scholars, and it's for students who say, I think I want to be a doctor, or I want to get a PhD, or I want to get a master's. They want to go beyond an undergraduate degree. And we've said, if you keep your grades up, and there's certain criteria, but if you do these things, we will not only pay for all of your years of undergraduate study, but we'll pay for you to go on and get your master's, to get your PhD, or even to get a professional degree, like a doctor of medicine degree. And we will even pay for 2 years of housing. You have to commit, though, that however many years we pay beyond your undergraduate years, you will dedicate working in the Rio Grande Valley. And the intent of that is to make sure that we get people to stay. We think if they stay for those 4 years, 5 years, 6 years, that they're going to stay. I know that when I came to the Rio Grande Valley, I said, I'm going to be there for a few years, and then I'm going back to Central Texas. And people said, no, you aren't. You watch. The Rio Grande Valley will suck you in. And here we are, since I've been here since '91. So it goes to show, if you give people the right opportunities, the right experiences, and people here are so welcoming and so wonderful, I think you will get people to stay. And so there's a big need. I also want to mention we've got a lot of collegiate high schools we've been putting up, and the students, God bless them, because they have to start at such a young age to try to decide what they want to do with the rest of their lives. But we get some kids that say, I know I want to be a doctor, or I know I want to get into healthcare. And so that's one of the tracks now of our collegiate high schools. We've got one going up in McAllen, we've got one in Harlingen that we've done, we've got one going up in Edinburgh, and the healthcare is one of those. In fact, the one in McAllen will be right next door to our cancer center that we're building. And so we want the students to see every aspect of healthcare so that they continue to build on that desire to be physicians and allied health workers and the nurses we need in the community and so forth. So a lot of great things that are happening, but we need the help in getting those slots for our residents and getting those slots for our nurses.